Hello, I'm Dr. Dennis McKenna. I'm joined today by Mr. John DePaula. JD, it's great to have you here.
Great to be here, Dennis.
John, of course, Senior Vice President of Diagnostic and Therapeutic Services. We're going to talk about that. I know you've been here before, but we'll cover your area here in just one moment. Today is Monday, December 23rd, giving you the update from Albany Med. And, John, I was thinking this is the last video of the year. I normally wear my ELF sweater, but I didn't have it on today. I forgot because we're shooting the video. I should have worn it today. But nonetheless, it's been a great year, obviously. I'm pleased that you're joining us for the last video here.
Thanks for having me, Dennis. And the ELF sweater, definitely tradition, and look forward to it.
I'll wear it to safety brief for sure. You've been here about 20 years, right, John?
20 years in April it'll be,
20 years,
Dennis.
and served in many different roles, both in the college and the hospital, and really just an incredible part of our team here.
Thank you.
All right, let's start with some great news. This is all good news today.
Yeah.
Everything here is good news. End of the year, we should obviously have focus on good news. Forbes magazine, everyone's heard of Forbes magazine, surveyed 160,000 people throughout the United States who work in large companies, and only select employers made a list, and that list included the best employers in any state. On the list for best employers in New York State, Albany Med. Albany Med made that list. So that's wonderful. Perhaps some of you out there took that survey, or maybe people in the region took that survey, but it's a great accomplishment, and obviously credit to our workforce. So, John, thoughts on that?
Doesn't surprise me at all, Dennis. I mean, we've got a great team here in all of our areas. Of course, I'm a little biased to our DTS team.
Right.
Just strong Albany Med spirit and morale.
Yep.
Great place to work, absolutely.
This goes along with another survey that was released a few weeks ago by Newsweek, right, where we were recognized as one of the best workplaces for diversity. And we've talked about that. 5 generations of workers. We have individuals from 80 different countries, right? We work closely with our Committee for Immigrants and Refugees, and we work closely with our Ability and the New York State Industries for Disabled. I think we're obviously an incredibly diverse workforce, and that makes us stronger. So fantastic news there. All right, John, Diagnostic and Therapeutic Services has 12 different departments. I'm sure if I asked you, you can name all of them.
That's correct.
We're not going to do that today, but in general, when we think of DTS, these are all of the support services that essentially make our hospital and our outpatient locations hum in areas like, and this is not the full list, pharmacy, laboratory, radiology, correct?
That's correct, Dennis. And really, we have over 800 employees working in diagnostic and therapeutic services, as I mentioned earlier. Great group of people, very enthusiastic. It's all about serving our patients, serving our community. And again, I get back to the morale that the group has is just overwhelmingly positive. Great group of people, and I got to call out our leaders.
Sure.
We've got 12 leaders in each of those departments.
Right.
Really, much like myself, people that have been here 20 years plus, in their leadership roles for over 10 years, they bring tremendous expertise to the table and really keep that morale very, very high. They're very conscientious of their employees, and we're very proud of them.
Right. One thing that I know that we have, obviously, is we have an Albany Medical Center Hospital Committee on Hospital Affairs. We also have a hospital board. You present there every month. You pick one of those departments and you focus on that. You talk about what services they provide. You talk about efforts of recruitment or retention. You share data with them that I think is very impressive. So their work is being presented at that level. And
Thank you,
you do a great job there.
Thank you.
Let's focus in on 2, if you wouldn't mind, just because I think they're both very interesting. There's something called a Vivastim device, and let me make sure I read this correctly. This is a collaboration between neurosurgery and physical therapy and occupational therapy, focusing on increasing upper limb mobility in stroke patients where recovery may have stalled. One of our incredible neurosurgeons, Dr. Alexandra Paul, puts in the device and working very closely with Fran Williams. And the first patient was actually will be featured in our system story. It's a patient by the name of Jenna Shursky. And this is something that physical therapy, occupational therapy, working with neurosurgeons, only place it happens in the capital region right here, Albany Med.
That's right, Dennis. And again, PTOT, like all of our other departments in DTS, great leadership, just an overall, just strong team, and we love those collaborations.
Yeah, watch for that article in the system story. Another incredible story is we installed a new lab line.
Correct.
We had the opportunity to tour it the other day when we went into our lab here on the Albany campus. This are, when a blood is drawn from a patient, whether it be in the inpatient location or the outpatient location, it's put into a test tube. There's obviously a sticker put on it, and it's run through a machine. And I'm oversimplifying it, right? But it's basically a track. It goes through and it gets analyzed, and it can go through many different stops. The bottom line is it's incredibly complex. And I think you'll describe how one of the things that we're doing here is relatively new and groundbreaking in the area of lab work. And I know you want to credit the team who got us there.
Yeah, definitely. Again, Joe Source, Devin Friedman, they've been our leaders. And really, Dennis, I think you've described it very well. Heavily robotics type of line, sorting out the specimens, both from a chemistry standpoint, which we went live with a couple of weeks ago. Hematology is going to be up next. This is a 3-month go-live process. That's really going to put us, no place other than the Capital Region in terms of a lab line that is able to process both chemistry and hematology, same line. It's an over 7-figure investment, which we appreciate our leadership investing in our lab services. And really, this is the foundation to moving forward with a bigger project over the next couple of years. We've gotten the go-ahead from our 4 hospital CEOs to look at opportunities to collaborate amongst the 4 laboratory hospitals to work more closely together, more efficiently, more effectively. And again, this is the foundation for us in doing that.
Regional reference lab, that's the goal in the future.
That's
the goal
correct.
in the future. And obviously this new lab line will also allow for results to be posted into the medical record quicker, which obviously helps with patient care, and in some cases maybe can make the patient ready for surgery sooner or discharge sooner. So it's really fabulous.
It is, Dennis. And again, the last point I'd like to make is I think sometimes what gets lost, because we're just so accustomed to dealing with it, over 8 million specimens a year.
Yeah.
We are
I was hoping you'd give that number.
We are one of the
incredible.
busiest laboratories in the country when it comes in terms of processing specimens. So just incredible work being done in our laboratory.
All right, very good. Thank you, and thank you to your team. 2 items to end on, both again very positive. The other day we had our Employee of the Year celebration. Always lots of fun. Happens in December. It's a surprise. I believe it was again this year, and we recognize Colleen Umholtz, who was the recipient of Employee of the Year. She was there. Her family was outside the room. They got invited in afterwards. 2 of her daughters are nurses and have worked here or are working here at Albany Med. Wonderful. Colleen is a clinical nurse specialist who works out primarily with our pediatric oncology population. She's been here for 36 years. Wonderful celebration, and I think everyone was very happy to see her get that award.
Really enjoyed it, Dennis, and we affectionately call her Queen Colleen.
The Queen.
I certainly have run into Colleen rounding on the pediatric unit there, and I'm sorry to say this. Well, I'm not sorry to say this, but her grandson, sort of stole the show. As
He
you
did.
mentioned, it was a
It was
great ceremony again. Colleen, outstanding. People are still talking about it today. So what a fun day. What a fun event.
And I first met Colleen outside work. She and her entire family volunteers up at the Double H Ranch, obviously a place that my wife and I volunteer up there. And Colleen has been very connected to that camp as well. Obviously, many of the patients she cares for in the hospital also go to camp up there. So just super well deserved, and really a great ambassador for our entire Children's Hospital. So congratulations to Colleen. And finally, we'll end on this very positive note. It will have finished by the time this video is done, but Melodies of Christmas always occurs this time of year. It's a wonderful event, takes place at Proctor's Theater out in Schenectady. We want to thank Freihofer's, Price Chopper Market 32, and of course WRGB Channel 6 for putting it together. Money raised goes to support our Melodies program at Albany Med. In the history of the program, which has been going on for many, many years, raised over $10 million. Why am I mentioning it? Number 1, because obviously we want to thank those who helped make that happen. But 2, you can still watch it, right? It'll be on TV. It's on Christmas Eve. It's on Christmas Day. Watch for it on Channel 6. But Melodies of Christmas, always a great event. And you ever been there? We've been there.
Definitely. Many times with family. Great Capital Region holiday tradition, and look forward to watching on Christmas Day.
A lot of the kids who've been treated at the Melodies program sing there. It's really very special.
Great entertainment.
So, Melodies of Christmas. All right, JD, that's it. Obviously, last video of the year, holiday season. We're a hospital. We run 24/7.
That's right.
And doors will not close. That's because we have a workforce who works on nights and weekends and holidays, and we appreciate you now more than ever for doing that. And we'll pick it up again next year. I wish you a happy holiday. Obviously, everyone on watching the video as well.
Happy holidays, Dennis.
Okay, great, John. All right, we'll be back again in 2025. We ask that you once again take care of yourself, take care of each other, and we'll see you next year.